Hello, everyone. I am Dr. Tahir from Youthful Medicine, and welcome back to my channel. Today, I'm going to talk about osteoporosis treatment in elderly population. Specifically, I'm discussing a case of an 83-year-old female who presented with recent vertebral fractures. Her DEXA scan showed that she had a femoral T-neck score of minus 2.9. Her lumbar spine T score was minus 2.1, and her wrist T score was minus 2.3, indicating severe osteoporosis of her femoral neck and osteopenia by numbers of lumbar spine and T score of wrist as minus 2.3. But since she already had a vertebral fracture, she's considered osteoporotic. So background, this patient used to be treated with osteoporosis about 2 years ago. She moved and lost follow-up and then ended up not getting any treatment and eventually led to this unfortunate incident where she fell and broke her bone. The What she tells me that the fracture happened after a very minor fall at home. And that's very common for patients to actually fall at home and develop osteoporosis related fractures. Most of them, they happen either they're at their own home or their kids' home and they're just excited to be around people, moving around and end up falling. So this is important topic and important. There is significant need for monitoring and assessing osteoporosis. Osteoporosis is often considered a silent disease and because it progresses without obvious symptoms until a fracture happens. So it is important that the physicians who are treating you are asking you to actually get the DEXA scan on a routine basis. And if you have a loved one who is in this age group of postmenopausal women or elderly parents, make sure that they get a DEXA scan. So what is important is that if we are looking at elderly population and with age, the risk of fracture is going up. The risk of fractures mostly happen in your spine, in your hip, and your wrist bones. As if you were to fall, regular DEXA scan can help evaluate us how the progression of the disease is and if we can intervene early and prevent these devastating outcomes, because 1 in 4 person who ends up having osteoporosis related fracture would never come back to their home. They will either end up going to a nursing home or they will become fully dependent on another person and end up losing their independence. So we always, when we see patients, we always discuss the benefits and the risk of treatments. Obviously, it is in the background of making sure that the patient is able to understand what diet requirements they need and what exercise requirements are there for osteoporosis. And these are important topics, and I would create video on them at a later time. Today, I'm going to talk about what I talked to her about 3 treatment options. Just to let you know that this patient previously was treated with osteoporosis medicine, and it was one of the bisphosphonates, but in the form of Fosamax. But I discussed with her 3 options. So my number one option, first option, I should say, was Evenity. Evenity is a romosumab. It's a another newer medication, which is with the brand name called Evenity. And the pros of this drug is that it works by both building new bone and slowing down your existing bone loss. So the net effect is that you have not only stopped the bone loss, which is happening in osteoporosis as a process of aging, but also building new bone. It is uh, it is very useful in patients who have history of fracture. So this patient would be a good candidate. Um, but the cons are that it carries a slight risk of cardiovascular events like heart attack and stroke. So patients with recent history of heart disease, stroke, need to be carefully monitored. And I usually get a good history about their cardiovascular risk before I offer them this medication. Second option is to consider is Prolia, which is denosumab. It is administered every 6 months as a convenient injection under the skin. It is highly effective in reducing the risk of vertebral hip fractures and other fractures, and it is mostly a very well tolerated medication, and this medication is widely available and covered by insurance. The cons are the side effects may include increased risk of infection, and the reason is that this medicine initially was discovered as a rheumatoid arthritis medication, and that's why many of my patients who are on Prolia would tell me that they actually feel that their joint pains are better. Um, so increased risk of infection happens if you are on a monoclonal antibody type of medication, or in this case Prolia, because they do cause some increased risk, very small risk. And in all honesty, I have not seen many patients getting infections on Prolia, although if somebody is dealing with an infection, I always tell them to stop their medication, pause it, um, until they have cleared up with the infection and their antibiotics have been stopped. Other risk factors are low calcium levels and severe bone pain, which doesn't happen, but it can happen, and I always warn patients. And stopping Prolia suddenly can lead to a rapid bone loss. So this is one of the things many patients don't know, and even many doctors may not know, that when you are giving somebody Prolia, you have to have an exit strategy. The reason is that when you stop the medication abruptly in Prolia, all the benefit of stacking up the bone loss that you have accumulated over the last 2 years, you would lose them. And in that 1 year, when you stop the medication abruptly, you can actually have more fractures than in previous times you would have it if you were not on medication. So people who end up having moving out of the state or non-compliant with the medication, they really need to be aware of this problem with Prolia. Reclast. So Reclast is my third option for this patient. Reclast is an IV medication. It's once a year infusion. Its generic name is called zolendronic acid, and it improves the bone density and reduces fracture risk. It's ideal for patients who prefer infrequent treatments. By the way, I think I did not mention Evenity, the first medication that I talked about that makes new bone and reduces bone loss, is given as sub-Q injections, and you get every month for 12 months. FDA has only approved Evenity for about 12 months for now. Going back to Reclast, it's once a year intravenous medicine. You get an IV line, and then you get it. Prolia is a shot in your subcutaneous tissue. We give it behind the back of your arm, and that usually can help you with the administration. It's easy. So my patient was naturally concerned about the side effects of these medications, and one of the ones that is common to all osteoporosis medications are osteonecrosis of the jawbone, which is a complication that happens if your bones are weaker. You have had the medication for osteoporosis, and you end up having a dental abscess, and your tooth needs to be removed, and you have a dental extraction and then dental implant. All of this is too much for the bone, which is being treated with osteoporosis medication, and can lead to a sort of a dead bone in your jaw called osteonecrosis. So obviously my patient was naturally concerned about the side effects of the medication, and I reassured her that while every medicine has potential risk, we monitor closely and weigh the risk and benefits for every patient, and they do definitely reduce your risk of fractures. But without treatment, your risk is a lot higher. 1 in 28 patients would have increased risk of fracture with osteoporosis, due to osteoporosis if not treated, and their side effects profile is much less. We have like thousands of patients who are getting treatment. Okay. Another thing is, in her case, basically I recommended her Prolia and Evenity. They seem to offer a best balance between the effectiveness and the side effects profile, or the safety profile was there. I emphasized the importance of calcium, vitamin D, weight-bearing exercises, and regular close medical follow-up. So if you have a loved one or if you are yourself in this age group and you're dealing with osteoporosis, it is important to talk to your doctor about treatment options and see what is the best treatment tailored to your needs. So, staying proactive about your bone health is important. And um, that is all what I wanted to share with you today. And I'll discuss this topic more in detail in future uh, episodes and videos. Um, I would request you to subscribe to my channel for updates on bone health, rheumatologic topics, obesity medicine, health and wellness, longevity. I am a quadruple board certified internal medicine, rheumatologist, obesity medicine specialist, and I also have integrative medicine board as well. So my practices spreads over from people who have rheumatologic diseases, primary care, wellness, longevity, and obesity medicine. So please share this channel with your friends and family. I hope that I will be able to continue to produce some good content for you, and and share my knowledge and expertise with you guys. So until next time, take care of your bones, stay well, and see you next time.